All right, let's talk about something that can literally make or break your entire career as an esthetician: safety. Today, we're diving into the absolute non-negotiables of infection control. And this isn't just about passing your exam. This is about protecting your clients, your reputation, and yeah, that license you've worked so incredibly hard for.
You know, this quote just nails it, right? This is the whole reason these exams exist in the first place: to protect the public. So as we go through this, don't think of it as just studying for a test. Think of it as learning the fundamental code of a true professional.
So, let's jump right into our first pillar, controlling that invisible world. We're talking about all the microscopic stuff, the threats that are everywhere, even in a room that looks spotless to the naked eye.
Okay, here's a little inside scoop on how these exams work. They're going to test your basic knowledge first. So before they ask you how to deal with microorganisms, they need to know that you know what they are. This difference between harmful pathogens and harmless non-pathogens, it's the absolute starting line.
And that idea of invisible threats leads us straight to one of the most important safety principles you will ever learn: universal precautions. It's a really simple but powerful rule. You have to treat all blood and body fluids as if they're infectious. That mindset, it's totally non-negotiable. It's what keeps everyone safe.
So, knowing all these risks are out there, what's our number one defense? This is such a classic question. You will see this on your licensing exam in some way, shape, or form. And it tests the most basic, but also the most critical action you can take. And the answer, and a huge focus on your exam, is just proper hand washing. I know, it sounds almost too simple, but it is the single most effective way to break that chain of infection right at its most common transfer point: your hands.
Now you might be thinking, I know how to wash my hands, but the exams, they get specific. They won't just ask if you should do it, they're going to test you on the exact procedure. Look at step 3, lathering for at least 20 seconds, or step 7, using that towel to turn off the faucet. These little details are what make or break an exam question because they're all about preventing recontamination.
This brings us to another topic that trips so many people up on the test: the difference between cleaning and disinfecting. Just burn this into your brain. Cleaning always comes first. You simply can't disinfect a dirty surface. It doesn't work.
So here's the deal with disinfection. It's basically a science experiment, and it only works on non-porous surfaces. Things like glass, metal, hard plastics that liquid can't soak into. You gotta follow the manufacturer's instructions to a T for mixing, and this is the big one: you have to respect the required contact time. If that surface doesn't stay wet for the full time listed on the bottle, you're not disinfecting anything. You're just giving pathogens a quick bath.
All right, so we've been talking about the tiny stuff you can't see. Let's zoom out now for our second pillar and look at the physical environment. These are the hazards you can often see, but might just overlook in your day-to-day.
This is a huge mental shift. We're talking about going from being reactive to being proactive. Your job isn't just to clean up a spill after someone slips. It's to notice that frayed cord or that cluttered hallway before it ever causes an accident.
Your exam is absolutely going to expect you to be able to spot these things. So just take a second and think about your workspace right now. Is there a physical hazard, like a slick spot on the floor? A chemical one, like poor ventilation? Or an electrical one, like a beat-up power cord? Recognizing these isn't just for the test, it's what you do every single day as a pro. So, knowing the risks, that's half the battle. The other half, our third pillar, is knowing exactly what to do when something actually goes wrong. A professional response has to be calm, correct, and most importantly, immediate.
All right, here we go. Another classic exam question. Picture this: an exposure incident happens. That means someone comes into contact with blood or another potentially infectious material. What is your absolute number one first move? The answer to this tests your ability to prioritize safety above literally everything else.
And the answer is always, without a single exception, to stop the service. Period. Before you grab a Band-Aid, before you start cleaning, you just stop. In that moment, client and practitioner's safety is the only thing that matters in that room.
And please remember, there are times when the safest possible thing you can do is to not perform a service at all. Refusing or stopping a service because of a safety concern isn't a failure on your part. It is the highest mark of your professionalism and your ethics.
Okay, final pillar. Let's do a rapid-fire round of the most common traps that pop up on the licensing exam. These are the tricky little points that often separate a passing score from a failing one.
Exam trap number 1, getting the order wrong. A question might ask for the correct disinfection procedure for a used tool. The correct answer will always start with cleaning with soap and water first. Any answer choice that puts disinfecting before cleaning is an automatic fail. It's a giveaway.
Exam trap number 2, ignoring that contact time. A question might describe a scenario where someone sprays a tool with disinfectant and immediately wipes it dry. The correct answer will flag this as an improper procedure, because that required contact time just wasn't met.
Trap number 3, underestimating equipment hazards. The exam might ask what you should do with a tool that's slightly cracked or has a minor fray in the cord. The answer is never, ever use it carefully. The only right answer is to take it out of service immediately.
And the final trap, forgetting to document. After an exposure incident, an exam question might give you options like reassure the client or continue if the client says it's okay. Nope. The correct answer will always involve documenting that incident according to protocol. That document is your professional record of safety.
Which brings us to our final thought. You know, after going through all these rules, all these procedures and safety standards, it kind of begs the question, who is the ultimate person we're trying to protect with all this diligence?
And here it is. This is the ultimate takeaway. It all starts with your client. By prioritizing their safety, you automatically protect your license. And by protecting your license, you secure your career and yourself. This hierarchy, client, license, self, that is the unbreakable foundation for a long, successful, and respected career in this industry.